bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
We're about to share with you the latest advances in radiation oncology when it comes to treating people with cancers. Hello again, and thanks for joining us. I'm Carla Showell-Lee, and you're watching Comcast Newsmakers. In the studio with me this hour is Dr. Luther Brady, an oncologist for Crozer-Chester Hospital System, and today we're talking about treatment for cancer. Thanks for joining us today, Dr. Brady. Nice to meet you. It's really interesting because I think that word radiation actually is kind of a scary word for a lot of folks out there.
I think that may very well be true, but that's really because of the lack of information. But radiation therapy is used in the treatment of patients with cancer primarily for those individuals who have limited local disease. And it's been used for the treatment of cancer for now more than 100 years. Actually, the first patient to be treated was in 1896, which was only a few months after X-rays were described by Röntgen. But it has been very effective in management of cancer, and now we see it used more often in combination with chemotherapy as well. Right,
it's considered to be a safe method for treating cancers. When is radiation an appropriate method for fighting tumors, though?
Well, I think that radiation therapy is appropriate when you using it as a primary treatment regimen for limited local disease processes like prostate or breast cancer or cancers of the lung or cancers of the head and neck. And more often in the more difficult tumors that we have to treat, it's being used in combination with chemotherapy in those tumors that have a significant probability of having metastatic disease to other locations, even though you can't identify them. 60% of all malignant diseases in the United States are cancer of the breast, prostate, colorectal, and lung. And the progress and advances in three of them, prostate, colorectal, and breast, have been dramatic and significant. The progress in lung cancer hasn't been anywhere nearly as dramatic as has the progress in the other areas.
And how long is the treatment process, would you say?
Well, the treatment process, relatively speaking, when the patient is being treated for cure, is about 6 to 7 weeks for the radiation therapy on a daily basis.
Okay.
And you may have chemotherapy simultaneously during the treatment program or before or after the treatment program with the radiation therapy. And that's commonly used in patients who have carcinomas of the lung, as an example.
Okay, so this latest advancement that we're going to talk about is called CyberKnife.
That's correct.
Very interesting name.
Right, it is. It's sort of a confusing, I think, because it doesn't really entail any kind of surgical technique in the usual sense of the word. It is really a manner of delivering the radiation to the tumor precisely without really irradiating the surrounding normal structures.
Which has been considered done in the past.
Yes. Well, you see, the evolution of events over time was to treat really larger volumes to be sure you always had the tumor in the field of treatment. I mean, one of the admonitions always true is that you can't cure the tumor unless it's in the field of treatment.
Got it.
Now, the CyberKnife allows you to treat the tumor on the basis of MRIs and CAT scans that are done to precisely define the tumor volume, and then to design the treatment program to treat the tumor and have a rapid fall off of the radiation in the surrounding normal structures. Like if you're treating the prostate, you'd like to protect the bladder to the greatest degree possible and the rectum to the greatest degree possible. So the CyberKnife allows you to do that. The innovative characteristic of the instrument is really the fact that the treatment machine and the table are moving in synchrony, so that you know in a continuous fashion that you always have the tumor in the field of treatment. And we can monitor that on the television screen outside the treatment room.
And what has been the success rate as we have
the success rate is really very good, as a matter of fact. The patients with cancer of the prostate, the cure rates are very high. In patients with head and neck, very high as well.
All right.
And brain tumors also as well, very high.
Well, important information. Thank you so much for sharing all of that with us, Dr. Brady.
I'm really delighted to be here. Thank you very much for asking me.
This hour's newsmaker has been Dr. Luther Brady, oncologist for Crozer-Chester Hospital System. I'm Carla Showell-Lee for Comcast Newsmakers, an exclusive production of Comcast.